can't fully diagnose a disc herniation from X-rays ever. It is not possible. Hi, it's Dr. SamdxB. Today I'm going to explain you a couple of facts about the X-rays and MRIs. So many people coming daily who tell me that they've had X-rays and they have been diagnosed with disc herniation or disc protrusion or disc problem. You can't diagnose 100%. You can't fully diagnose a disc herniation from X-rays ever. It is not possible. X-rays are not for soft tissues. X-rays are for bone tissues. So when you do an X-ray, what you see is only bone. When you're suffering a neck pain or low back pain, even if you have leg pain or arm pain, the doctors usually, whether it's in a hospital or in a private clinic, do describe you first an X-ray because it is cheaper, it is faster, and it is much easier to do. So this is the first line of diagnosis. It doesn't mean that it is the last line of diagnosis, and very often if there is a disc symptom such as arm pain and leg pain, to confirm the diagnosis of disc problem, disc herniation, whatever it is happening in a disc, you do need to have the MRI. The MRIs are for diagnosing the disc because with MRI you see all the soft tissues. You see the muscles, you see the ligaments, you see the tendons, you see the soft tissues, the fat and everything else, and you see the discs. So MRIs or a CT scan can diagnose the disc herniations or disc protrusions. I'm going to show you the difference so you understand. So in here we see the vertebral bodies. There's 5 of them in the lumbar spine or in the low back. We'll count them from up to down. So 1, 2, 3, 4, 5, and you've got the sacrum and the pelvic area here. You've got the pelvic bones and you've got the sacral bone, and then you've got the tailbone here at the bottom. So with X-rays, you just can't see you can't see the disc material itself. It only appears as grey as the area where you have tummy or the muscles in your buttocks or the content of your pelvic area. So you can't really see the disc material. It doesn't look any different than any of the other areas except the bones, of course, and they appear white because they are full of calcium, and that's how it looks in X-rays. Let's say that you've done the X-ray and the doctor says that there is a degeneration, the space between the bones in your spine have decreased, so the area where the disc is flatter. The doctor can say with the educated guess that there could be or there will be, especially if you have the symptoms of the disc herniation, he can say pretty much certainly that there is a disc herniation. But medicine has to be certainty, there has to be confirmation of the diagnosis, especially if you're thinking of having surgeries or anything drastic like that. So when we go and we think about diagnosing further and making sure that the diagnosis is correct before taking any plans for treatment, we should have an MRI as well. And I'm going to show you why. So here you see the vertebral bodies again, just like you see in X-rays. It doesn't look much different, but on top of that you see these grey areas, almost like little cookies with little jelly inside. And these are healthy discs. You see when it's white, it's healthy, there's liquid inside there and it appears white and a little bit of grey inside. But when you look at this picture here, this disc here, it looks darker. It looks much darker than the one above it. And if you go all the way down here, you can see that it's completely black. Now it has lost the liquid, and this is actually not the biggest problem here. When it's lost the liquid already, it's gone through its degenerative changes, but the one level above, you can see that there's this spinal cord, and there's a little bump here, but there's a much bigger bump there. This would be a lumbar disc herniation. This is between the 4th and 5th vertebra in the low back. So it's L4, L5 disc herniation. And you can see even untrained eye can see the difference between healthy disc and a sick disc. This one is swollen here, it's inflamed, it's pressing on the nerves, it's pressing on the protective layer on top of the spinal cord, and it's probably giving a patient symptoms such as numbness, pins and needles and tingling, or burning sensation, or it can even cause loss of strength or loss of muscle function. Now you understand the difference between X-rays and MRIs, but regardless of the cost and the procedures and so forth, if you do have leg pain, if you do have arm pain, which are the first symptoms and signs of disc irritation, the first thing you should always do is to contact your doctor, chiropractor, you can contact your GP, you can contact orthopedic surgeons. Chiropractors are very capable and very good at diagnosing and also treating disc herniations. If you still have questions and you're not quite sure what to do, send me a message, ask me questions. I would be more than happy to answer you and take away your worries.